Hello, everyone, and let me also give my welcome and thrilled that you are here to participate with us. Um, Talitha Guinn-Shaver is our next speaker. She'll be sharing some of the report around the um, needs assessment and the information that she gathered from EMDT folks listening session across the nation. And I hope that many of you participated in that. I'd like to say that she has been in this work for a good long while, serving in San Francisco as the EMDT coordinator and working with the Department of Justice, Elder Justice Initiative. We're thrilled that Talitha's a partner in this work with us, and I'll turn it over to her now.
Thank you, Lisa, and thank you all for having me here today to talk about the first national MDT survey. And want to just have a quick disclaimer here that these views are my own and not necessarily those of the U.S. Department of Justice. So some of you may remember that last year we had an MDT summit. In the lead up to that summit, we hosted a series of MDT listening sessions. And after listening to MDTs around the country, we decided it would be nice to do a formal survey, and that was approved through the Department of Justice. So this is a report out of our findings after talking to 116 different respondents from around the country. This is truly a nationwide survey, and there is a broad representation of roles, disciplines, and geographic context. This is a short presentation, so I've provided the link to the survey. So if you have interest, you can go dive a little bit deeper into the report. You can read the full questions, and all of their responses are housed within that report, along with some things that we tried to pull out that we thought were of particular interest to the field. So you'll get a copy of this presentation, and you can just click on this live link here to go and view the report yourself. I'm going to kind of cruise through some of the opening questions because they're more demographic and less juicy, and we'll try to get to the juicier content. But wanted to say that the majority of participants identified as a coordinator or a coordinator slash member. So some teams did have people who filled multiple roles on their elder abuse MDTs. Primarily, we saw responses from APS. And so I think that reflects a national trend of APS being very involved in their local level elder abuse case review teams. And I was really surprised and pleased to see that we had an almost three-way split between rural, urban, and suburban teams that were represented in the survey. Oftentimes we see that rural can be underrepresented in these types of conversations. And so it was really nice to have rural and tribal teams contributing to this survey and sharing their experiences as well. I also wanted to note that a lot of the MDTs serve more than one area. So you might have a team that serves both a suburban and an urban area, or a suburban and rural, or rural and tribal. So just to keep that in mind as well. The beginning of our survey really focused on best practices, person-centered and trauma-informed practices, and ageism awareness particularly. And overwhelmingly, we saw that MDTs valued these perspectives, person-centered, trauma-informed, and ageism. And so as we dug a little deeper with the teams, we wanted to look at what's working well and what are some of the barriers to implementing these philosophical frameworks in their work. And when we looked at person-centered practices, we saw that a large number of teams really agreed philosophically that their work should be person-centered, but the barriers were more structural and capacity-based. And one of the most prominent requests in this regard was to have more training, not just on the practices, but in implementation of the practices for their elder abuse MDTs. When we got to ageism, that's when we sort of saw that teams thought that this was an important topic, but that it was less concretely defined in the field and it wasn't as operationalized in MDT work. And so there was less implementation when it came to ageism awareness. We saw that there are quite a few practices that are currently being enacted with MDTs. And taking a look here at the person-centered practices, we can see that a large number of people look at evaluating the cases in a holistic capacity. And that was one of the tools that they had in their toolbox when they were trying to integrate more person-centered practices. Some teams focused on informed consent. Others had intake forms or databases that try to integrate those person-centered practices on the front end. But overwhelmingly, once we got to the point of these cases being heard around the table, that's where we saw the majority of teams trying to take a person-centered perspective on these elder abuse cases. And then looking here at trauma-informed practices, it seemed that trauma-informed care is more embedded in the review and analysis than on the front-end engagement. So that is again happening more at the point of the case review rather than at those initial conversations and intake forms, etc. We also asked a series of questions about evaluation and data collection. And evaluation capacity seems to be limited and inconsistently applied across teams around the country. You see some teams primarily that have direct federal funding that have a more integrated approach to how they are going to be conducting program evaluation, clear concepts around their case outcomes that they want to see and what their process is going to look like working together as a team. And and so as you see teams just kind of at the grassroots level coming up, is kind of unevenly applied across teams around the country. Client satisfaction surveys were a topic that came up in the conversations with the survey, and that was something that was very infrequently used, whereas in other fields like domestic violence and child abuse, there's more feedback, direct feedback from the clients typically. When we looked at what is needed for more teams to have a focus on program evaluation, we saw that there was a real lack of infrastructure, time, and guidance. And so teams are really looking for tools that they can use that are accessible and intuitive and cost effective, and also want support with how to collect and analyze that data as well. And then we're looking at primary challenges working on elder abuse cases more broadly. These are the things that MDTs sort of came up with. They noted a lack of community resources, a need for specialized professionals to participate on their teams, a lack of funding, which is usually number one, but that came up here as well. In third place, coordination challenges, so agencies knowing how to work with one another, and then legal or policy barriers at the system level were also noted. We asked these teams to look ahead to the future and what they saw the needs of elder abuse case review teams being in the next 5 years. And the core needs that came out of this sort of open-ended response was seeking sustainable funding, having workforce development, so training and implementation of practices, improved communication, person-centered holistic services, and case tracking and evaluation. When we look at sustainable funding, we were getting quotes from people like more funding for law enforcement, APS, and coordination. Coordinators are stretched thin and often unpaid. So really seeking that stable, dedicated funding is something that was coming up in a lot of our respondents' comments. In workforce development, we saw that there were needs around having qualified professionals with protected time to participate, access to specialized professionals. Forensic accountants in particular were mentioned quite a few times. Prosecutors that were actually trained in elder abuse. We saw that a lot of comments talked about prosecutors being trained in other areas, but then assigned to case review or to these case review teams, and then working on elder abuse cases and needing more support in their work. There was also a need for geriatric medical and mental health providers, a reduced turnover. And this is something that can be very challenging for MDTs to grapple with because you often don't have any say over who's assigned to your team. And agencies within themselves, like law enforcement or a prosecutor's office, might have people move to different divisions and things like that. So that can turn over who's sitting at the table with you in an ongoing manner. Other things that were mentioned, including addressing staff burnout and methods for sustaining engagement long-term over the course of the life of the MDT across agencies. And so some quotes that we found interesting. It's difficult to find professionals with the time and expertise needed to participate meaningfully. And cases are getting more complex, especially financial exploitation, and we don't always have the right expertise at the table. So this is just a sampling of some of the comments that were in the survey. And when you go to the survey, you can read more of them. In the need for training, there was a request for training on financial exploitation, cognitive impairment and capacity, trauma-informed and person-centered approaches, technology-facilitated abuse and scams. So the more complex these cases are, wanting to understand AI and other ways that technology is being used to exploit older adults and how to best intervene in those cases. Cross-training so that members understand each other's roles and constraints, and practical case-based learning rather than just theory alone. So a couple of the quotes here: we need advanced training on financial exploitation, scams, and cognitive impairment, and training needs to be ongoing, not one time. Elder abuse is constantly evolving. So in this question we asked, what about the future needs of MDTs? There was a strong belief in the importance of MDTs, concern that demand was increasing faster than capacity, and a fear that MDTs will stagnate or dissolve if they don't have proper support. MDTs play a crucial role in addressing the needs of victims, but we do not have the resources to keep up with demand. That's one of the quotes. The work that MDTs do is invaluable, but without sustained funding and staffing, teams risk burning out or dissolving. So this is a common theme that we saw here in question 15. In the technology needs, there was a request for databases and case tracking tools, virtual participation options, and tools to address technology-facilitated abuse. So quite a few people noted that they want to track cases better, they want to have better data collection, but they were lacking the systems and the tools, the infrastructure to do that well. Rural and underserved communities noted that there's resource scarcity, especially in the more rural or underserved areas. There's need for culturally and linguistically appropriate services, and that there's gap in access to specialized professionals. So there are some quotes here with people kind of grappling with where to engage specialized professionals to help ensure that they were getting the feedback and insights that they needed to work on these complex cases. National standards and leadership. So there was a request for clearer best practice guidance. So in this field, there has been less sort of structure around what an MDT has to be, how it needs to work, what practices need to be implemented. And if you were to look at other types of teams that get federal funding, like sexual assault response teams, for example, they have very strict guidelines about the training that you have to have and the best practices that you're expected to maintain. But when it comes to elder abuse teams, it's been a lot squishier over time. So there's many different types of elder abuse teams, and they have sort of different rules around what they do and the practices that they implement. And mostly what we see are guidelines and suggestions rather than this is what it takes to do it. So I think that teams across the country have really been kind of reaching out and asking for greater guidance and just to kind of firm up some of this information about the best practices that they could be using. They also noted a lack or a need for greater national leadership and coordination and practical tools rather than abstract models. So a couple of quotes here. We appreciate the increase in resources at the state and national level, but clear guidance on best practices would be helpful to help MDTs become more effective. And MDTs would benefit from national standards and examples of what successful teams are doing. So I think that that was some common things that we were hearing. And that also was echoed in the listening sessions that were done as well. Here are some of the key takeaways or key findings. MDTs are essential, but insufficiently resourced. So across roles and regions, respondents express a strong confidence in the value and effectiveness of teams, but they warned that MDT capacity is not keeping pace with demand. There's increasing complex cases. There are fewer resources that are geared towards these types of teams and cases. And so while there's goodwill, that there can be some real spotty implementation of practices across the country. So they're really asking for some sustained investment at the national level as well. Strong alignment with best practices, but uneven implementation. Very few respondents viewed these approaches as being irrelevant, so person-centered, trauma-informed, and ageism, for example. But they did say that they needed additional training, funding, and guidance about how to integrate these practices into their work. So we saw that relationship driven teams really outpace systems level infrastructure. So are MDTs doing the work? Yes, they're doing it with their own grit rather than the support that they really deserve. They have people that are passionate, care about this issue, are invested in relationship building, trust building, communication, building regular meetings, having consistent participation across agencies. So these are very powerful strengths that they noted, but they aren't being met with the formal structures that could really help them excel in their work. And so these are areas where we're going to be focusing our work at the Elder Justice Initiative in the future. Workforce capacity and specialized expertise remain critical gaps. So they identified quite a few shortages of trained professionals. So some of the things that were noted were geriatric medical, mental health providers, forensic accountants, people with real estate expertise that could help on real estate cases. And they also noted burnout and turnover. It was contributing to the workforce load and capacity issues that they were experiencing. And that they also lack the tools to measure what matters most. So they're wanting guidance on what to measure beyond prosecution. They're wanting standardized tools to track cases, victim outcomes, and system improvements. And they're wanting training and support for evaluation design, data collection, analysis, and reporting. Geography and access shape MDT capacity. MDT serving rural, tribal, and underserved communities reported compounded challenges. Included in these challenges are limited access to specialized professionals, fewer community resources, and other barriers to participation on MDTs. And they emphasize the need for technology-enabled collaboration tools, which is just a fancy way of saying, hey, we need stable internet so we can have virtual meetings, and we need other ways to get professionals around at least at the state, to be able to participate on these more rural teams with us and give us feedback. We need responses that are culturally and linguistically appropriate for our clients. And again, the call for national guidance and leadership. Before I lead into the Q&A, I wanted to note that we are trying at the Elder Justice Initiative to meet some of these needs. So we did the survey, but that's not where we stopped with the work. So you can go on to the Elder Justice Initiative website, and you can see that we just hosted a webinar about AI scams and the complexities that are involved for MDTs and investigating and collaborating on these cases, and how you can better integrate the work on these types of cases going forward. If you take a look at the MDT summit that we did in 2025, on that page, we've designed a report there from our listening sessions, and it includes data sets that have come from the field that people feel are important. And it's a combination of what we found in research about data collection on MDTs and from surveying MDTs themselves. And so you can see the data points that the field is sort of agreeing are important to capture whenever you're doing that case intake and follow-up. And so we're seeking to sort of start filling these gaps, but we're open to collaboration on any and all of these ideas. And I thought I would save a little time here to chat with people who are on the call today to see, does this report align with what you're seeing in the field? Do you feel like there's anything that we missed or that should be included? Any ideas for or suggestions for meeting some of these needs that are in the report?
Thanks, Talitha. So if you'd like to come off mute and ask your question, you're able to do that. We're lucky that we've got Phil working the rooms and helping us out on that. So Talitha, I wanted to see if I went ahead and put your Elder Justice Initiative website in the chat. And I know that you're with the findings that you've done, you're looking at ways of addressing that. Can you speak to some of the resources that folks could find on the website there and some of the work that you've done? Thinking particularly of the toolkit and the trainings that you provide.
Yeah, so the MDT guide and toolkit, if you haven't taken a look at that in a little while, it's worth taking another gander because we just updated it and we added a chapter on program evaluation and data tracking in that chapter as well. And so that, and coupled with the listening session report and the report that I'm sharing here with you today, gives you a nice look into the data points that people around the country feel are worth tracking. Did someone have a question? I think somebody came off mute. Was that Evelyn or no? I'm sorry.
I did have something to say though. I have the last meeting. A lot of folks they come on their lunch break, and so we decided it was going to be a lunch and learn. And I had over 20 again this time, so they were happy to hear that. And so that should maybe increase the folks that are coming. That's what I'm hoping, and I've already increased them a lot, and so I'm looking to increase maybe 10 more by the next meeting. I'm not sure. I think maybe that would help.
Yeah, that's a great idea. I love the creative solutions, and also what the lunch and learn implies that there might be a little cross training or a little training element in there as well, which is a wonderful thing to do with your team to help keep everyone leveled up with their education. So that's wonderful.
Thank you.
Mhm. Anyone else have any thoughts or questions?
Hey, it's Arlene.
Hi, Arlene.
Hey, so I was just thinking maybe trying to tap into um, folks that are retired, that were in the profession, that might want to participate on the team. So if you're looking for a particular, I was just thinking of it now. I was thinking of prosecutors, but then I also realized that there aren't that many prosecutors that were just that really have an expertise in elder abuse per se. But I think it's worth checking around to see if there's special victims prosecutors, somebody that's retired that would want to be on the team, whether it's a doctor or any specialty.
Again, thank you. I love the creativity that people are bringing in to apply some solutions here. The Elder Justice Initiative is doing that. We have some retired prosecutors working on our team on our education materials. And so that's a great place to tap into that expertise. But the model that you're talking about was implemented in San Francisco, where we recruited retired financial experts. So there were people who worked in financial industry in various capacities, and we recruited them to work on the financial abuse cases that were being seen in San Francisco. The way that it worked there was they were onboarded as a civilian volunteer through the law enforcement agency and seated within the law enforcement agency. And so they went through all of the formal vetting process that you would do as any civilian would do that was working with law enforcement. And then they helped them work through a backlog of elder financial abuse cases and helped build really beautiful cases that were able to be presented to the prosecutor's office. And in fact, they were so successful that they got stolen by the DA's office. Because they were doing really good work on their financial crimes. So we had to recruit more. So definitely looking into tapping into your retired community. I think especially as funding issues have become more prominent and people are talking about the scarcity of funding, looking at community solutions like that is going to be really powerful. Any other thoughts or questions?
Talitha, I had a question around just kind of the initial line of like thinking when you were asking questions around person-centered, trauma-informed, and more ageism related orientations for teams. And I know that one of the things that you were kind of pointing out was at what stage of the team process do these questions get asked, or do teams start thinking about it? Is it your thought that, I mean, is the thinking behind it that like there is a role for it to emerge at all stages
Yeah.
of the process, or do we within the team process think that there ought to be a stronger emphasis at a particular stage? Like I wasn't
Yeah.
sure when you were sharing the results, like how to read that result,
Yeah. So in the new MDT guide and toolkit, we have a section on these practices that's brand new. And what we did is we took each of these trauma-informed and person-centered practices, and we looked at how they might be integrated throughout the team. It was everything from the initial intake. So how does the case come into the team? What questions are being asked and how are they being asked? What data is being collected for what purpose? And is it being done in a way that is respectful and will cause less harm to the older adult down the road? So looking at everything from that very beginning to how are we asking them what they are hoping the outcome will be? What do they want? What do they need? They're going to be, when you work with an MDT, you're going to be engaged with multiple systems. And so having a clear understanding from the beginning of what is good for this client, it may not be the same thing that's good for client B and client C. So really taking an individualized approach to see what's going to work best for their mental health and for their access to justice, and not just looking at the team's goals, but really what would be best for each individual client. So then you have bring it down to, well, how's the interviewing being conducted? How many times is this person having to tell their stories? In what ways can we streamline this process so that we're getting what we need in a forensically appropriate manner? So do we have a forensic interviewer that can handle this in our community? And then to the case review, being aware of our own biases that can come into play as we're hearing cases, and making sure that we're keeping that client centered as we're talking about potential remedies and solutions and courses to take throughout the various systems. So, and then in my personal opinion, one of the places where elder abuse MDT has kind of dropped the ball that we don't see so much in the other field is at the end. So providing clients with a soft landing. It's not like, okay, well, we prosecuted the case and goodbye. I hope your life is great. But where we're looking at what sort of wraparound services does this individual need to heal and reintegrate into the community, or to be shored up in a safe way to make sure that they're either at baseline or better than when we interacted with them initially. And so there's definitely points at every process and with every agency.
Yeah.
So in any case, yes, it can be done throughout.
Yeah, and what I'm hearing you say is a lot of it should also take place outside of the parameters of the EMDT, because it is reliant on individual kind of team members and their institutions to build these processes, even at like early stages of intake within their own organizations.
Yeah, and the MDT is sort of this hub, right, where all of these agencies are interacting. And so I think it's also a great place for cross-training on these practices so the other agencies can take them and integrate them as well.
Thank you.
Well, I think that we're right at time. I know I got started a little early, but are there any last thoughts before I turn it back over to Lisa? Well, thank you so much for letting me be here today to talk about the report. And I hope that you'll take a moment to go over to the Elder Justice website and view it more thoroughly and look at the other reports together in this sort of package that we've put together at the end of 2025, beginning of 2026, to help kind of guide the field. That includes all of the resources around the MDT Summit, the listening session report, and this one. We're again open to collaboration, thoughts, and ideas as we seek to fill the gaps that have been identified.
Talitha, thank you so much. And we're, as I said, pleased to work with you on this issue, and grateful that you've been a part of our project at the National Center, as well as your work on at the Department of Justice. So thank you so much.
Thank you.